The lady herself is in the studio now. Nicky Howe, of course, CEO of Southcare, aged care services at home. Nicky, good to see you.
Good to see you, Jenny.
Good,
how are you?
Really good. You're back from Russia.
Yes, a month in Russia with my husband, which was amazing.
Yeah, well, I've not been there, so give us your views on it.
Look, you can certainly feel the empire in Moscow. I thought what really struck me was the way they look after people. So they definitely look after their own people, yes. Transport's exceptional. If you're Russian and you say go into a museum, you pay less than obviously a person like myself.
If you're a citizen.
Yeah, so if you're a citizen. So they really look after the citizens. Very easy to get around Moscow, but I didn't realise how big it was until we went up on one of those big tall buildings, and 23 million people live in Moscow.
Wow.
So that's pretty much the whole of Australia in Moscow. So it was amazing, quite amazing.
So their housing would be high-rise?
A lot of high-rise, but very much community. So a lot of people who've got the live in a high-rise have all got community gardens.
Oh, that's so good.
We're talking about elderly. They definitely look after their elderly, and that was really nice to see. The elderly people were valued in the community.
Gee, that's nice, isn't it? Do you think they'd like to run for Prime Minister over here?
We shouldn't go there, should we? We've had a week of it, haven't we?
We've had more than that.
And I'm glad that the Honourable Ken Wire remains the Minister for Aged Care.
Yeah, you'd be very pleased.
For Indigenous health. So that's really good because he understands that aged care. There's a major issue around them needing to increase the amount of money for aged care, and Ken's across that. So I'm really pleased that he remains in that portfolio.
Now, last month we talked about the changes from home and community care to the community home support. You've had a lot of inquiries, haven't you, at the program?
Yes.
Now, today you're going to talk about what for us?
Look, I thought I would talk about how do people go about accessing services.
Right.
Because I think that can be one of the most difficult things
to get started.
How do you get started?
Yep.
So I thought, I'd talk about that. I'll just recap. So I'll just say that there are essentially two programs that can support people to stay in their own home, in their own community. So the first one is the one we talked about last month, which is the home and community care. So that's low-level care. And then there's the home care packages, which is a higher level care.
More help required.
More help required. And with home care packages, there's 4 levels of care, and they each attract a different level of government subsidy. So, I thought about, how do people start the process?
Yeah, who do they contact first?
Who do they contact? So, the first thing is they need to book an assessment.
With who?
Okay, so they need to get an appointment to book an assessment.
Who with though, Nicky?
So they go onto the My Aged Care website.
Yep.
And I know that you're going to give those details out later. So the My Aged Care website, or they can call My Aged Care. So that's 1800 200 422. Or they can call Southcare and we can assist them in the process.
Okay, that's the first step.
So the first step is they need to book an appointment to be assessed. Right. And I would really encourage people that if you're finding that you've got a little bit of difficulty with a few things, make that call now and register to be assessed, because it can be quite a long process.
How long are we talking?
Well, the assessment process, if they're low-level care, they can pretty much get assessed straight away. And so there's 2 assessments. There's a regional assessment team if it's low-level care, or if it's high-level care, they'll see a ACAT assessor, and they're usually clinicians. Okay, so there's 2, depending on the questions that they'll get asked, and I'll cover that. If it's low-level care, they can generally get services probably within 2 to 4 weeks.
Yeah.
But if they need a home care package, the wait times can be 6 to 9 months for a level 1 or 2 package. Or if they are assessed as needing higher care, level 3, 4, it can be up to 12 months.
That's a pity, isn't it, really? Because if you need high care, you need it now.
Absolutely. And that's why I really encourage people to at least book an appointment so that you can get assessed.
Assessed as soon as possible.
Yeah.
Okay, but 12 months is a long time.
It's a long time.
Do you think that could be changed eventually?
Well, let's keep putting pressure on the Minister and the government.
Well, they've acknowledged the aged care crises. I suppose we're practically there.
We are there. We're definitely there. And so I would say, if you have the opportunity to talk to your local member, talk to him about the concerns that we have.
Absolutely. Okay, now, what questions will people be asked?
Yes, so look, you will be asked some questions, and it generally takes about 10 minutes. So I'd encourage you to, before you make the phone call, I'd encourage people to keep a diary and start to write down the things that they notice are getting harder. So what are the things that you're having difficulty with? Yeah. And I would encourage you not to be embarrassed or think that you're making a fuss, because I think what people do is they go, oh, look, it's okay, I'll leave it. Mm-hmm. But what that can do is you can have difficulty with those heavier duties, and then you might find yourself that you have a fall or you have an injury because you didn't get that support early.
Good point, yeah.
So get yourself organised, consider the things you can and can't do, get your Medicare card out, and these are the questions that you'll be asked. So what support are you currently receiving?
Would it be personal support, family support?
Yeah, so you might have a partner that's supporting you,
right.
You might have children that are popping around and supporting you, you might have a friend, or you might have a community group that's supporting you. So they'll ask you, what sort of support do you currently get? And then they'll ask you, well, what sort of health concerns do you have? Mm-hmm. And if we think about that, what often happens is we might have difficulty lifting. Mm-hmm. We might have problems with our shoulders. We might have problems with our knees.
So the medical problems that you're experiencing that you've probably been to a doctor about.
Yeah, you could have been to a doctor about, or you're starting to notice that you can't lift things. You might have arthritis, for instance,
very
and
common.
You're finding it's hard to lift things.
Yeah, especially if you're living on your own.
Exactly.
Yeah.
They'll ask you how you're managing with activities around the house. So how are you keeping up with the garden?
First thing to suffer.
First thing that suffers is often the garden.
Of course, yeah.
How are you coping in the shower? Are you able to actually, bend down and do your toes? Are you able, do you feel safe? Can you wash your hair, or have you got problems with your shoulder or your elbows?
Yeah.
So they'll start to say to you, what are you finding is difficult? Often, I think the first sorts of things can be the garden, it can be transport, it can be lifting things.
Mm-hmm. There's a lot of things. What if somebody is calling on your behalf?
Yeah, look, people can call on your behalf, so all you need to do is make sure that you give them your consent.
Do you have to give the consent over the phone to the person?
Yes, you just give the consent over the phone.
All right,
yeah, so certainly that's a great question, and people, sometimes people are calling on your behalf.
Okay, now moving on to the assessment process, that's after the first call.
Yep, so after the first call, they'll make a decision about who they're going to send to you. So whether it's a RAS assessment, which is generally low-level care, or whether it's going to be an ACAT assessment.
Regional Assessment Service.
Yeah, the Regional Assessment Service or the Aged Care Assessment Team. And that will be determined by My Aged Care.
Yes.
So when you've made that phone call, they'll make the decision about who they're going to determine is going to do the assessment for you. And they will come out to your home.
Good.
Okay, so they'll come to your home and they'll look around at how you're managing. And they're going to focus very much on what you can do and what you might need a bit of help with. Because what we want to do is we want to really help people to stay independent. So we're not going to, we're going to find out what they're capable of doing. So it's very much a wellness approach. Now, let's say, for instance, you are in hospital. So you might have been in hospital and you're coming out. They're saying, look, it's, we want to prepare for you to come out of hospital. So an ACAT assessor actually can go and visit you in hospital, and they'll find out, what are your care needs, what are your complex needs, and they'll coordinate a range of services.
If you're in hospital when you get to that point, have you already had an assessment? prior?
Well, let's say, for instance, somebody is at home and they're managing okay, but they have a fall.
Okay, that's when
often this can trigger that assessment. So they've had a fall.
Have they made the call, though? That's the thing.
No, they haven't made a call.
Okay.
They've had a fall and they've had to go into hospital. And in hospital, they'll determine that they do need help to get when they get home.
Good.
So, so an ACAT assessor can actually go into hospital. And what the ACAT assessor will do is they will determine the level of care needs the person has.
Okay. So is it up to the hospital to make that call to get the ACAT people come in, or do you request it?
The social worker will do that.
That's what I was wondering.
Yeah, the social worker. So the nurses will arrange that. But I would say to you, if it's your family member or it's yourself, make sure you ask for it. If they don't mention it, which they will, but just say, look, can I make sure I get assessed for a home care package?
All right. We'll go to a couple of calls before we continue. Rosalie, hello there.
Oh, hello.
Yes, Rosalie. Go
Hi,
ahead.
Rosalie.
Oh, hi. I just had a question about what requirements you need to be eligible for a home care package.
Yeah, look, that's a great question. Look, generally, Rosalie, a home care package is meant for older people. There actually is no minimum age requirement, but generally it's for people over 65, or if they're from Aboriginal or Torres Strait Islander, it can be 50. Look, there's no citizenship or residency restrictions on a home care package, but if you've got a visitor, say, from England coming to Australia, and they need temporary or short-term care, it's really not meant for them. Yeah. Okay. If they need short-term care, they would probably require some private services.
Okay, good to know.
Okay.
Thank you, Rosalie.
Does that help, Rosalie?
Yes, thank you.
No worries, thank you.
Thanks for your call. And Louise, good afternoon.
Oh, hi, Jenny.
Hi, Louise.
I'm calling. Hi, Nicky. I'm calling for a friend of mine. I've known her for a long time. She lives near me, and she's struggling, but she won't admit it. And I'd really like her to get some help, but I can't just go in and take over. That would be an awful thing to do. She's embarrassed about the things that she can't do anymore.
Shouldn't be.
I don't think she wants to be seen as a burden, but I don't know what to say to talk her into. You've talked about the process of registering to get an assessment, and it can be a very long process to get some help.
Yeah.
But I'm not quite sure what kind of language to use to talk her into
to start
consent.
to try and
start the process, because it's going to escalate. And I mean, as you pointed out, the sooner she kind of gets registered, there'll probably be a lot of things I'm not even aware of that she struggles with, because she tries to keep it to herself.
Yes,
quite
yeah.
common,
Thanks for this question, Louise. I think start with finding out the sorts of things that she thinks she would like to have done around the house, and generally the garden is a good one to start with around her safety. So you could, say to her, look, how about we try and get someone in to do a little bit of garden maintenance to keep you safe, so that you don't have a fall, because often, the footpaths, the trees, that sort of thing. So I would start to try and get her on the introducing her to some gardening and a little bit of help around the house with domestic assistance with some of the bigger jobs that she can't do. So really trying to emphasise that, not taking away her independence, but saying, well, some of these big jobs are a bit difficult. We could get someone in to work with us to help you.
Yeah. That sounds good.
Yeah?
I like the idea of garden, because also she used to keep a really beautiful garden, and she doesn't now, and I think she misses her flowers.
Yeah, so that's a way that you could tap into something that could be a concern of hers, and it's not then focused on what she can't do. It's focused on someone helping her to do the things that she really likes to do.
Makes a lot of sense.
Thank you so much.
No worries.
appreciate giving all the advice about how long it can take. Thank you.
Yeah,
Thank you, Louise.
Thanks,
Thank you.
Louise.
I think there'd be a lot of people that feel they're going to be a burden if they start to put their hand up, and it's something they have to deal with.
I think that is so true, and we're talking about a generation of people who often have been in the war years. They've been, very determined. They've worked very hard. They've got a particular value set. They don't want to be a burden.
They don't want to say, I need help, is probably what it is.
And
yeah.
I think that's why it's really important for us to engage in that conversation about not taking away their independence.
Yeah, very true.
But saying to them, this way you actually can stay in your own home because there's no risk of you falling or having an accident.
Very true. We're going to have another call in just a moment, but what happens once you have been assessed and get the confirmation letter? What happens then?
So once you get the confirmation letter, then it's time for you to choose a provider. So you actually get to choose who you want to provide your care.
Are they competitive?
They are, but I think the things that people need to look for is they need to, search for a few providers. So if you went onto the Southcare website, we've got a conversion tool, and so a comparison tool which you can download, and you can download it. You can see what our fees and prices are. You can use that comparison tool to see what our offer is, and then compare our offer with a couple of other providers.
That's a good service. That really is. Okay, we've got Andrew joining us. Hello, Andrew.
Hi, Andrew.
Hello. Good afternoon, both of you.
Thank you.
Listen, how do I say this? We've just gone through this exercise with my parent-in-law. We downsized them, put them into an over 50, got them into an over 55s. I'm going to say my mother-in-law, she's 85. You could eat breakfast off the garden. That's how she maintained it.
Yeah.
Seriously, absolutely immaculate. But we said, look, so we've downsized them and said, look, we'll get you a bit of home help.
Yes.
Because he's worked for Telecom all his life, and because they had a couple of dollars in shares, they were declined. So it must be a very thin line.
Means test.
Means tested, and then of course, when it was means tested, she was grade 1.
Yes.
And he was grade 4.
Yes.
But what the how would you say it, the agency was charging, it just annihilated any monies they were receiving.
Yes, well, that's why I think it's really important that you do a fee comparison for different service providers, because you will be able to see that some service providers charge particular fees and other service providers don't. So, I would really encourage you to actually look at the different fees that providers charge, and then you'll be actually able to see that it would be worth them getting a home care package. And yes, they might have to make a contribution, but they still would be better off with that package. And there is a lifetime cap on a package. So people, once they've contributed $64,000, so that's, over the life of, they then don't contribute anymore.
$64,000?
Right.
Yes.
Doesn't have to go pay out.
So
one more quick question. With different agencies, is there a big variance between agencies?
Yes, there is.
Okay, that's interesting.
Yeah, there definitely is a big variance. And let me just recap about that $64,000. That's the lifetime cap. So you talked about a level 4 package. The amount that a person could be allocated for that is $4,270
from the government.
But once they've, if they've been paying for their own care for a period of time, say 2 years, after that 2 years, if it's that amount, then they would get that care for at no cost.
But $64,000 seems a huge outlay, doesn't it?
Well, it's not really a lot if that's over 2 years and you're getting care for 2 years.
$64,000.
Yeah.
Wow. Okay. It's a lot of gardening.
Yeah, but this is this is for a whole load of services.
Oh, okay.
Yeah.
Okay. Yeah. Still a lot. Okay, Andrew. Thank you very much.
Does that help you, Andrew?
It steered me in the right direction. I'm still a little bit concerned because basically the agency was charging $70 an hour.
Yeah, well, I don't think it's only the hourly rates you've got to look at. You need to look at the basic care fees, whether they charge exit fees. So there's a whole load of fees. Go onto our website and download our comparison tool, because that's a great place to start.
Okay, and what you will read out your website again?
Yeah, so it's Southcare. So if you Google www.southcare.org.au.
Lovely.
Thank you, Andrew.
Thanks, Andrew.
Thank you. Now, what about privately funded care, finally?
Yeah, so I think this comes and speaks a little bit to what Andrew was saying, that, you know, some people who are self-funded retirees, they might not get the full subsidy rate, and so they might have to pay themselves.
Yeah, of course.
Or people who are waiting for a package, but they obviously want to stay in their own home. You know, aged care providers do provide privately funded services.
Okay.
So it's important, again, to do your research around how much they charge, but they are an important stopgap to making sure people get some support.
Dominic, good afternoon.
Hi, Dominic.
How are you?
Good. Go ahead.
Okay, just a quick question. Can, receiving the carer's allowance through Centrelink, are you also able to access the home packages?
Yes, because the carer's allowance is for the person who's caring for the person that would require the package. So, yes.
Okay.
So if you're caring for somebody and they're not getting any support, I would really encourage you to get that person assessed.
Right, okay.
They have to be assessed first.
So even if the carer is receiving the full amount of the Centrelink?
Yeah, because the home care package is assessed on the person requiring the care, not the carer.
No. So who should you go to about this? Centrelink?
Yeah.
Or?
So no, don't go to Centrelink. Get the person, get them to ring up My Aged Care, and actually get them assessed. So this person has not been assessed. Is that correct?
No, they've been assessed. We're just still waiting. But then there's also been a carer's through Centrelink. The carer's allowance has been granted. So I didn't know if it's worth still waiting for the package to come through.
Oh, absolutely. Absolutely, you want to make sure you get that package.
Okay. Yeah, I thought they might knock it on the head because there's two benefits coming in. But
No, not at all. It's completely different.
okay, no, that's fine.
Okay, thanks,
Okay,
Dominic.
thank you very much.
Bye-bye, Dominic.
Bye.
Thank you. There you go, Nicky. Solved a few problems for people.
Yes, well, hopefully, and I really want to encourage people to, make sure that they do go onto the My Aged Care website if they need.
Or ring
Southcare if you're not sure. We're happy to take any questions because we really want to educate people around what's available.
And My Aged Care number is 1800 200 422. And we'll see you next month.
Yeah, thanks a lot, Jenny.
Nicky Howe.